The reason why I was so devoted to this is because I wanted to take an active role in my recovery and my survivorship journey. I wanted to have a sense of control and have a positive outlook in life. And so if I wanted to create change, if I wanted to make a difference in how my life looks the next month, 6 months, a year, I needed to actively find resources that will provide benefits for myself. And I was so excited for the exercise portion because I knew that it will have a positive outlook in my life, and it did.
Hey everyone, welcome to season 3. This is Shauna.
And this is Rosalina, and we're your hosts for Too Young for This Shit podcast. This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you a raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hi everyone, welcome to the Too Young for This Shit podcast. I am your host, Rosalina, and today's episode is unique as I share my personal experience in a breast cancer clinical trial. I would definitely say before being a participant, my perception of clinical trials is way different. And I had a lot of hesitations in the beginning, but I think that clinical trials play a critical role in advancing medical knowledge and improving cancer treatments. And so I think that when you're given an opportunity to participate in a clinical trial, it's crucial for you to have an open and honest discussion with your healthcare team to understand the details and risk. There is a wonderful nonprofit organization called bctrials.org, and they list out myths and facts about the trials. And so I'm going to link it down in the show notes for you to read. It was really informative, and it definitely has changed my perspective as well. So the clinical trial that I was in was called IDEA study, which is intervention with diet and exercise for women taking aromatase inhibitor. And it was through my hospital system, UCLA. The purpose of this study was to explore bone strengthening exercises and the anti-inflammatory Mediterranean diet's potential benefits for women taking aromatase inhibitor. So there's 2 different interventions, and I'll dive more into how I discovered the opportunity and how I gained insight and what I've learned from it. So how I stumbled upon the clinical trial was through my medical oncologist. Every 3 months, I visit my oncologist, just do the regular checkup. And that was back in May of 2022. When I was in the appointment, she mentioned about a clinical trial. And right when she mentioned that, I was like, if it has to do with medication, count me out. But I essentially said that, and now looking back, I said that because I was on my 5th month with the aromatase inhibitor. I was having joint pains. I didn't want to mess up the flow of what I was able to control and in managing the side effects that I had. So she interrupted me. She's like, no, Rosalina, it actually doesn't have to do with medication. It is an exercise and nutrition trial. And so my ears perked up and I'm like, okay, tell me more. So she mentioned that with the exercise portion, you'll be paired up with a personal trainer. And then if you are in the nutrition intervention, then they give you this food plan, and you'll be able to have the Mediterranean diet that they give you. And then also you have to pick up the snacks that the nutrition department at UCLA would give you. So there's like two different interventions. And I was really interested and intrigued by that. And one of the things that, I ask about, this is really interesting trial. I've only been diagnosed with cancer for 2 years now, but I think my perception of clinical trials always had to do with medication. And one of the things that she mentioned to me is that it is challenging to find funding for non medication trials. And most of the clinical trials have to do with medication because the pharmaceutical companies are the ones funding the trials. And so when it doesn't have to do with medication, then it could be harder for people to get behind the trial and find the funding that they need. So I thought that was a really interesting point. And my oncologist, I feel like I learn from her every time I see her, and she just has so much wealth of knowledge just from not even like the medication that she gives her patients, but I think just outside perspective, I feel like I've gained valuable insights from her. So, in order to be in this study, I needed to get screened. Dr. Carpenter, who's the principal investigator, she gave me a call one day and she wanted to confirm my eligibility for the clinical trial. And one of the things that you needed to be, so you need to be on the aromatase inhibitor for at least 6 months. You need to be diagnosed with at least stage 3A or less, and you need to be experiencing joint pain. So I passed the test, even though I was on aromatase inhibitor for 5 months in May of 2022. I was going to have surgery in June of 2022. And so I would have to delay being a part of the study. Back in, I would say, June of 2022, I was having surgery. So I was switching my expander to implant, and I needed to rest at least 8 weeks before I even enter the clinical trial because I wasn't even sure which one I'll be in, and they wouldn't tell me unless I like signed up. While I was healing for my surgery, I kept thinking about like the clinical trial, and I wanted to learn more because Dr. Carpenter gave me just a brief info about it. And I emailed her wanting to get some sort of like pamphlet of like exactly what it entails. And so once I received that and once I read it through, I was even more interested in the study because I was like, okay, oh my gosh, this is such a great benefit. One, obviously, I was leaning more towards the exercise portion than the nutrition side, but I was very excited for the exercise portion because I wanted to learn the proper exercise form from a personal trainer. I wanted to learn how to alleviate the joint pain, but I also wanted to just gain as many benefits as I can with the personal trainer and just learning how to be better and to understand the benefits of exercising. So, a couple of them are muscle preservation. So, strength training helps to preserve and build muscle mass, which is crucial for maintaining overall strength and function. Bone health, as we all know, if you're on aromatase inhibitor, it can lead to weakened bones. And so, strength training, especially weight bearing exercises, helps to improve the bone density and reduces the risk of bone related complications. Lymphedema management. So, if you had lymph node surgery at any point in your life, you can develop lymphedema, which is a condition where the arm or the hand swells up. And strength training exercises, it could help with reducing the risk of their flare ups. For me, especially, I have tightness from radiation on my left shoulder. The exercise portion would definitely help reduce that. And I get pain sometimes too when I'm not really actively using my left arm. So I knew that by consistently going through the exercise portion that I'm able to alleviate that pain. And of course, the other benefits that we all know, it's combating fatigue. enhancing your physical function. So the ability to just do your daily activities and just to perform and enhance your overall quality of life, and just boosting your mood and well-being. It helps reduce anxiety, depression, and stress. So I was all for the exercise intervention, but I wouldn't know which one I would be in until I actually signed up and whatnot. Once I was healed from my expander to implant surgery, I went in to the nutrition department and I completed the comprehensive assessment before officially joining the study. So I needed to fast. They drew blood. I had to do a DEXA scan and a body composition measurement to establish the baseline. They had like a little gym room where Dr. Carpenter, who's the principal investigator, had me work on these different machines and lift whatever maximum I could, such as like the leg press, chest press, bicep curls, etc. And that was used as a baseline for the trainer to see how much I have improved over time. And then once we finished all of that, they entered my name into the computer system. And that's when the computer would determine which intervention I would be in. And so I was in the exercise portion and I was super ecstatic. I was like, yes, this is what I wanted for the longest time. So Dr. Carpenter walked me over and showed me the gym, which was only like 5 to 6 minutes from the actual department. And the gym is 10 to 15 minutes drive from my house. So that was also a great benefit too. I was paired up with a personal trainer, and the protocol was that I would meet with the trainer 1 hour twice a week. It would be over a period of 12 to 14 weeks. And the training structure was in increments of 4. So from weeks 1 to 4, we'll focus on endurance. From week 5 to 8, strength. And then the last 4 weeks will still continue with the strength portion. But basically, how they programmed it is that in the beginning, the endurance part, it is higher reps, lower weight. With the strength portion, so 5 to 8, then we would lessen the number of reps. We would increase the weight that I'm lifting. And then from weeks 9 to 12, that was like I do 1 to 2 reps, but I lift the maximum weight that I can. So that was, I don't know, for me, I really love the challenge and I love seeing the motivation and progress. So that was really interesting to do over the past 12 to 14 week period. The other thing to mention is that because this was like a 3 month period, I couldn't really skip a week. They advised not to. So I couldn't go on any vacations. I had a family vacation back in Florida that I did not attend. Everyone else did. I was a little jealous, but I was like, you know what? This is for my health. So I stayed, of course, to finish the trial. One thing about my trainer, so it was a male and he was in like, I don't know, I keep changing the number, but I think he was like in his 50s and 60s. And he's a surfer, which I don't know, for me, I would think like when you're older, you don't really do that, but he's done it all his life. So I thought that was really cool. I was really inspired. He was an introvert and I just got along with him. So that was fantastic. And during the workouts too, I mean, he would challenge me and I really liked that. I want someone to push me. So I thought that was like a great pairing. But one of the risk factors, and I think we all know about this, but when you exercise, if you lift too high or incorrectly, you can hurt yourself. There was one exercise called the farmer's walk. And basically, you are holding 2 different dumbbells on the side, and you're like walking across the room and then walking back. At first, we did 10 pounds on each hand, so a total of 20. And that was great, that was lightweight. And in the following week, he wanted to increase it because he thought that like the 20-pound weight total was probably too light for me. So he wanted to increase that. We went from 10 to 20 on each hand, a total of 40. And when I did that exercise, I felt my whole entire arm and like lower back hurting. And I was like, oh my gosh, this is so heavy. The next few days, I was very sore. I was very sore from that particular exercise. And I knew it was from that because I could feel my whole entire body being like, okay, this is probably too heavy. But I kept pushing myself because at that time, I didn't really know, like, of course, like you want to listen to your trainer, and when your trainer says, oh, I think we could increase it, yeah, that's fine. And so after that session, and when I felt sore, it was a different type of soreness that I don't think I've ever really encountered, because it was essentially on my back left side, so where I had my surgery, and it started from the back of my shoulder all the way down to my lower back. It was very painful. I could not sleep on my left side. I tried to massage it. Whenever I like touched it and like try to massage it, it would hurt so bad. And so I messaged my physical therapist, who I've seen for my lymphedema management way back when I did my mastectomy surgery in 2021. And so I messaged her and I basically explained the situation. And her response back, I felt it was not helpful. So essentially, what she mentioned was like, oh, because of my history of cancer, there was essentially nothing that she could do. I felt like she could have helped me more in that case. She could have asked me to come in and then for her to actually see which area I was talking about. Yeah, I like felt dismissed. Once I discovered that it was from the farmer's walk, I went back to my trainer when I saw him and I communicated to him that I was really, really sore. And I think he also helped me trying to figure out ways to massage the area. So he was really helpful. My physical therapist was it. And once I mentioned to him that type of exercise was not doing me justice, the great thing about a personal trainer, even if you have a set schedule and like a program, they can always tailor it to your ability. He took that exercise out, which thank God, because I actually do not like that exercise. And we took it out and basically created an alternative exercise, which I don't remember what that was. But I thought that was a great approach that he done. And ever since that, I did not have that type of soreness that I've experienced. And so I think by communicating with him, you know, exactly what's happening and if I'm getting hurt or whatnot, like he's the best person to talk to. And also, he wants all of his patients to complete the trial. He had another participant who got hurt, and instead of going to him, she went to the department, and the department like took her out of the study. So he was a little upset because he's like, you know, I could have helped her. We could have figured it out and all that. But at the end of the day, you know your body best. And if you're hurt and you're like, I can no longer go back to the gym, I can no longer do this trial, you know yourself best. So I understand both parts. But yeah, so going on to the weeks that I've been seeing him and just the consistency of going to the gym, I felt like of course, like my energy levels were high, my stamina was increasing, and I just loved like the challenge. I was looking forward to our training sessions, and he would challenge me. He would say, for example, if we did an exercise about the box jumps, he would be like, well, you can jump higher. So he would like put more boxes on top, and then so I would have to do that exercise and jump really high. And then one of my goals actually that I explained to him was like, you know, by the end of this, I want to lift 50 pounds, whether it's like a deadlift or when I do like a squat with a kettlebell, like anything, I just want to lift 50 pounds, which I surpassed that. I was able to lift 80 pounds, which was incredible. And that was just with one rep, like one rep, you do 80 pounds and that's it. So that's what I mean by surpassing my goal. Surpassing your goal is just a fantastic feeling. And then two more things. We were doing planks, and in the beginning, I did like 15 seconds. Then we went on to 20 seconds, 30 seconds, 40 seconds. But I told him, like, I want to hit 1 minute. And at the end of it, I did. And it was, again, great that I'm able to accomplish that. The one thing I did not accomplish, though, was he wanted me to do a regular push up, and he really had faith in me. And I'm like, yeah, no, because I tried and I failed miserably. I like totally failed. My left side is still, well, at the time was still weak. And so like I could feel my right arm going up, but then my left arm just like staying in the same place. So that I couldn't do. But everything else, seemed to go. The other exercise that we did, so on Fridays, it was a little bit more like cardio. So I think it was like 20 to 30 minutes. I would have to wear this stupid ass heavy vest that each week he would add the pounds onto the vest. And so I had to wear this vest and go on the treadmill and basically do my highest speed of walking, which was like 3.5. And then I would have to walk for, like I said, 20 to 30 minutes. And it was just a type of exercise I did not look forward to. I thought it was boring. I was like, why we're doing this? That was the only thing I was not looking forward to. I was looking forward to everything else except for that. Mid-study, so I think it was, maybe in the 5-week mark, 6-week mark, I went back to the Department of Human Nutrition and did the assessment again. So I had to fast. They drew my blood, measured my body composition, my DEXA scan, just to get a baseline of like where I was at. Of course, also just measuring improvements and so forth. And then I did my last one when I hit, I think, the 12-week mark. And they did the last exam and the assessment of, again, they drew my blood, the DEXA scan, measuring my body composition and all of that. And so at the last day, Dr. Carpenter told me that she saw improvement in my bone density scan from the first to the last. So that was really great to hear. At the end of the study, I got paid $150 in gift card, and they did mention in the pamphlet that their personal trainer was valued at $3,000. I did get a free gym membership over the 3 months. So the gym that I was going to before the study, I paused it for 3 months and I was able to gain the amount of money that I paid for the gym. And I'll explain at the end how much I paid for the gym. And also I'll include resources as well. But going to like the life-changing results of the clinical trial, as I mentioned, the impact of exercise on my body and the improvements in the bone density overall of the course. I mean, it was such great improvements. And the best part of it all, I think it was the 3 or the 4th week mark, I was no longer experiencing joint pain. That was the best thing, because before, when I was experiencing joint pain, I was experiencing it in my hand, in my right hand, in the mornings, and then in my knees. And when I like dance, that's one of my hobbies. After my 9 to 5 job, I take like a dance class, and it's just so, certain moves are so hard on your knees. And being able to just no longer experiencing that joint pain just made me like a better dancer. And also, I don't feel like I'm in an 80-year-old body anymore. I feel like I'm in my own body, like the age that I am, 30 years old. And so that's another great thing about the trials. Like I feel like myself again. So so those are the benefits there. And I did ask my medical oncologist. I wanted to see if she had any like data on this, but I was asking her, even though, yes, I did this trial and I had to stop going to the gym for a period of time because I had to go back and do a revision surgery for my implants in October. So there was a good period of time that I was not exercising and I did not feel any joint pain. The only pain that I did feel was like my left shoulder, but with joint pain, I did not feel that. So I asked her, I was like, why isn't that I no longer have joint pain anymore? She couldn't really answer that question. She said they know that exercise has great benefits. And that's all she could say. So I just took it. I was like, okay. I just wanted to get some insight just for the listeners, but I didn't. So some of the insights that I gained while doing the exercise clinical trial was the importance of having a schedule and allowing your muscles to recover for just an effective gym workout. Let's just say you're going to the gym on Monday and you're doing arm workouts. The other thing was the difference between endurance versus strength. So, endurance, if you want to maintain your muscle, you do more reps and lower weights. But if you want to increase your muscle, you do the strength portion, which is higher weights, lower reps. And, before being diagnosed with cancer, I thought for the longest time that weights would make you bulky, but I understand that it is really difficult to do that as being a woman. But overall, strength training is important in increasing your muscle mass and just important to stay strong. I think that's the thing that you should take away from it. And the other insight that I've gained is like the positive transformation in my physical ability. So it's just like the simplest things that you can think of. One, let's just say you're traveling and you're carrying your 50-pound suitcase. Before, I would have trouble with that, meaning like when I was going through my diagnosis and had my mastectomy surgery and all, that was a struggle for me to even lift 50 pounds. But going through this trial and consistently going to the gym, I'm able to do that no problem. Carrying heavy things like your groceries up to your house, I think, that's important, right? Like you want to be able to carry your groceries all the way to your home and not have breaks and whatnot. And also picking up my dog Louie, he's 30 pounds. He's a little heavy. So I have no problem picking him up whatsoever. So it's like those littlest things that makes a huge difference. And the last thing is the reason why I was so devoted to this is because I wanted to take an active role in my recovery and my survivorship journey. I wanted to have a sense of control and have a positive outlook in life. And so, if I wanted to create change, if I wanted to make a difference in how my life looks the next month, 6 months, a year, I needed to actively find resources that will provide benefits for myself. And I was so excited for the exercise portion because I knew that it will have a positive outlook in my life, and it did. So, my perception about clinical trials has changed. And I think that there needs to be more representation for minority groups and people of color in clinical trials. And the more participants we have in clinical trials, it could create a more tailored medical plans for yourself in the future or just anyone else that's diagnosed with cancer. And ways that you can find clinical trials asking your healthcare team, but also even going online through the National Cancer Institute. I'll put that in the show notes, or going through bctrials.org or any nonprofit organizations. Like I think Triple Negative Foundation has resources about trials. If you're also looking for other resources with clinical trials, Shauna will be providing those resources that she has encountered. So listen to her episode as well for that. And then lastly, I think if you want to get into exercise, if you want to get into fitness, check your health insurance. Go through your portal because there might be a fitness benefit that you just don't know about. So, for example, I think it was like last week for me, I just kind of went through my insurance portal and I have United Healthcare. And I went through the fitness section and I saw that I could get a discounted gym membership through this program called Rally. They have like different tiers. So they team up with different gym locations. And it's not only just like gyms, you can also take classes at like Pure Barre or yoga, and I can attend those classes 4 times a month while also being able to go to the gym. And so I go to YMCA near my house, and it basically cut my gym expense in half. So I used to pay $125 and now I pay $60, which is like a huge benefit. The other thing that I've discovered from United Healthcare is the free Apple Fitness for 1 year. And if you have a Peloton, they were advertising like they'll give you a free Peloton membership for a year. And another thing that I've encountered is they'll give you gift cards for completing daily health tasks. So it's like you meet with like a health coach, like they have a program for that. And if you meet with them 3 times, then they'll give you like a $25 gift card. It's just like those benefits that we just don't know about. And so I would highly, highly recommend just going through your portal or even calling your health insurance, just asking, hey, this is my insurance. Do I have any fitness benefits? Because you just never know.
A very special thanks to our podcast producer, Bethany Allard, and our podcast editor, Ayla Anderson.
Thank you all for listening and supporting our podcast. Sharing our stories with you has been incredibly healing for both of us, and we hope it helps other women in their journeys through breast cancer.
Ladies, if you enjoyed this episode, please share it with your friends and fellow breasties. Help us reach more women by subscribing and rating us on Apple Podcasts, Spotify, and now on YouTube. You can follow us on Instagram at TYFTS Podcast and email us at tyftspodcast@gmail.com. We love hearing from you guys, so shoot us a message. We will link any resources from the episode in our show notes.